Tammy is here just 8 days after becoming the first West Coast patient to receive this new artificial heart. I want everyone to give a warm welcome to Tammy and her cardiothoracic surgeon, Dr. Michael Bowdish from the Keck Hospital of the University of Southern California. Welcome to you.
Yeah, Tammy, you look fantastic. You look absolutely fantastic. How do you feel? That's what everybody wants to know.
Terrific. A lot better than I did a few years ago.
How has it changed your life?
I've got the opportunity to grow old with my family.
And if everyone's quiet for just a moment, I want everyone to listen. That sound, it's like galloping horses. That's actually the device in Tammy's backpack that is keeping her artificial heart running. And for those of you that don't know it, remember how I asked who knows what it is? Well, of course, Dr. Bowdish and Tammy knew what it was. But this device is called the Freedom Driver. It's a small portable air compressor. It takes air from the outside and compresses it to drive the pump in the little backpack that Tammy wears. And of course, as they said in the tape piece, lot smaller than Big Blue, which was that 500-pound controller that people used to have to use, which of course would make you bedridden and have to stay in the hospital. But Dr. Bowdish, the question that I have is it easy to implant that in someone like Tammy?
It's actually quite difficult. Tammy was very near death, and we took her to the operating room. She knew she was going to have an operation, but I don't know if she really understood all the inner workings, but that was okay. And put her to sleep, opened her chest up, and literally, as described in the video, took out about 2/3 of her heart, including both ventricles, all the valves, and then sewed connectors to what's left, and then literally popped these ventricles back in. There's two sides, one part's air, one part's blood, and the air comes in and out, and it gives the patient a pulse, very much like you or I have. The goal is she's now been home for about a week, and she's living a very good quality of life, and she's going to await for a heart transplant, hopefully in the next couple months.
I don't think people out there realize it, but we in fact have a shortage of hearts. Obviously, we saw you in surgery. You have the technology. You can do these heart transplants now, but one message that we want to send today is you need to be an organ donor. You need to sign up because just checking that little box may help save the life of somebody like Tammy.
For Tammy now, when you're going around with the backpack, is it almost an afterthought right now?
Yeah. Sometimes it's like I get up to go to the kitchen, and it's like I kind of forget that I have it and
I mean,
pull the cord
compared to Big
a little
Blue,
bit.
I mean, I was looking at her and I'm going, what's working for her? And it's hidden behind your husband's leg. I didn't even see it.
Yeah, but it's important to note that the backpack's not pumping blood.
No.
It's pumping air into your artificial heart.
Well, Tammy, you are an inspiration. Congratulations. And Dr. Bowdish, great work.
Yeah.